name's Emily Purcell. I'm an occupational therapist at Vision Australia. First off, I want to thank you for welcoming me to this lecture series, and for also all of you who have logged on for making the time just to learn more about how to support people who are blind and who have low vision. I'm looking forward to sharing some of Vision Australia's expertise with you. So today we're going to be talking about risk factors and strategies for falls prevention in the blindness and low vision space. So remain on mute throughout the presentation, and if you'd like to ask a question, just type it into the chat, and we'll have some time at the end to have a look through the chat, answer the questions, and you can come off mute and ask questions live too. So before I go any further, I'd like to acknowledge the traditional owners and the traditional caretakers of the lands that we're meeting on. In Perth, that is Wajak Noongar Budja, or land, and where I'm presenting from near Northam is Ballarong Budja. It's NAIDOC week this week, as you may know, and I encourage you all to engage with the history, stories and culture of Aboriginal and Torres Strait Islander people from your region. And so we acknowledge that we're on Wajak and Ballarong land, and we acknowledge and pay our respects to elders past and present. We value and respect the ongoing culture and the contribution that Aboriginal and Torres Strait Islander people make to our communities. To give you a bit of an orientation, this is what we're going to be covering today. So a brief overview of Vision Australia, what is low vision, risk factors for falls in people who are blind or have low vision, some strategies for falls prevention, and then also how and when to refer to specialised blindness and low vision services. So to start with, an overview of Vision Australia. So our mission is to support people who are blind or have low vision to live the life that they choose. And we support more than 27,000 people across Australia of all ages and life stages, from birth up to 99 plus. So that makes us a leading provider of blindness and low vision services, and we've got 36 locations across Australia. We're a non-for-profit, and we're a major participant and partner in the international blindness community as well. Our main aims are to create equal opportunity so that people who are blind or who have low vision can get an education, get a job, be as independent as they choose to be, and be included in all aspects of society. So Vision Australia will work as part of a person's care team to provide the specialised low vision side of their support team. Our organisation is made up of hundreds of subject matter experts from a range of different specialties. And so we can offer a wide range of supports to people who have low vision or are blind. And that's things like emotional support in groups, occupational therapy, orientation and mobility, which is a blindness and low vision specific allied health professional. Orthoptists who specialise in functional vision assessment. We have education and employment support, age and equipment, assistive technology, assessment and training. We do services for early intervention, children and adolescents. Seeing Eye Dogs is also part of Vision Australia. We have a library, an audiobook library, which is free for clients or anyone who has a print disability, and it's got thousands of audiobooks as well as audio versions of daily newspapers, magazines, and heaps more. We can provide helpful information and advice, and we can also assist people to access appropriate funding support such as My Aged Care or NDIS. So enough about us. Let's talk a little bit about low vision, just to give you a bit of a foundational understanding of what we mean when we say blindness or low vision. So effective vision isn't just how blurry your vision is or what type of glasses you need. It's made up of a number of factors and also the integration of these factors by the brain. So some of these factors include visual acuity, so both your near and distance visual acuity, visual fields, and visual field is how far in the peripheral you can see when you are looking at a fixed point. Contrast sensitivity, the ability to distinguish an object from its background and to see in 3D. Depth perception, that's our distance, judging how far away something is and also seeing things in 3D. Colour vision, sensitivity and adaptation to light. Too much light or glare can wash out an image, and I'm sure you've seen that. And lots of people experience pain and discomfort from even just normal levels of light. And so that's something to really be aware of. Night vision as well. So they may not be able to see when they're outside at night, or in a shadowy or a dimly lit area, such as a restaurant or a cinema. Fluctuations day to day also affect people with low vision, and this can be caused by the vision condition itself, or by medication, illness, stress and fatigue. And finally, visual fatigue. And this is how long a person is able to use their detail or distance vision before it becomes uncomfortable. And that has real functional implications for the clients that we work with. Some common eye conditions that you might come across here are simulated on this slide. So the first image is typical vision. Looks like a market with an outdoor market with lots of people and some yellow sails over the top. The next image along on the top line in the centre is a simulation of macular degeneration. So this might be age-related macular degeneration, ARMD, or it might be caused by another condition like Stargardt's disease. And that causes blurring in the central part of the visual field. And this can get worse over time. On the top right-hand side, we've got a simulation of diabetic retinopathy, and that's sort of got patchy vision with floaters. And obviously every person with this condition is different, but people may also have double vision, they may be sensitive to glare, and their vision can fluctuate over time. And so each client that you meet or patient that you meet, their vision will be slightly different. Glaucoma on the bottom left-hand side. This is caused by intraocular pressure, so increased pressure in the inside of the eye. It causes permanent vision loss if not treated quickly. It causes a kind of halo effect where things are really washed out and glary. And so people with this condition are really impacted by light and glare. It really takes away any available vision that they've got. In the centre at the bottom is retinitis pigmentosa. And so this is essentially tunnel vision and the gradual loss of peripheral vision as their visual field becomes more and more narrow. And in the bottom right-hand corner is cataracts. I'm sure you've heard of it. There's sort of a film at the front of the eye, and the vision becomes cloudy or blurry. And this can often be corrected with surgery, but sometimes it can't. So we've got detailed information about these conditions and more on our website, including patient handouts. So I'd encourage you to hop on there if you're interested in learning more about common eye conditions. So low vision can also have a neurological cause, not just structurally something happening with the eye. And this is caused when there's been an acquired brain injury. So this can have different presentations depending on the location of the damage. There can be a return to an immature state of vision development, or in an infant, the failure of the vision to develop in a typical way. Or if there's damage along the optic tract or the optic nerve, then we have lots of different presentations of this, loss of visual field in different areas depending on the location of the damage along that pathway. So let's get onto the falls part of things with that background knowledge in mind. I'm going to share a bit about the risk factors of falls for people who are blind and have low vision. I'm sure you're all aware of the general risk factors for falls just in the general population. And I've got a bit of a summary on this slide. We all know that the more risk factors that a person has, the more at risk they are of experiencing a fall. So having low vision is actually one of the risk factors. And so falls are much more common in people who are blind and have low vision. And that's multiplied when the person has more risk factors present. So today, to kind of structure what we're talking about, I'm going to be using this model, which is by Injury Matters. It's part of their Stay on Your Feet program, which is WA's state falls prevention program. I'm going to be talking about factors related to the person, to the environment, and to their daily activities and tasks. And so elements from each of these areas interact to cause a person to be more or less likely to experience a fall. And if there's any OTs present, this is going to be very familiar. It is based on the PEO model. So we'll start with the person factors. Firstly, there are aspects about a person's vision that actually put them at a high risk. And these factors can act to prevent a person from being able to predict, avoid, mobilise and adapt to hazards in their environment. So blurred or cloudy vision, which prevents the person from seeing hazards in walkways or changes in floor levels, spills on the ground. Reduced visual field, that's either central or peripheral vision loss, prevent the person from seeing hazards that are not within their available visual field. And there's going to be things like oncoming traffic or a door frame or another person coming toward them. So that reduced visual field really does create quite a increased falls risk. Reduced depth perception, meaning you could under and over reach for things, more likely to lose your balance, and also have difficulties with stairs and changes in floor levels. Glare sensitivity. So this is glare from the sun, but it could also be glare just from light fixtures in a room or glare reflecting off surfaces, both indoors and outdoors. And this can be really painful and uncomfortable for some people with low vision, and it reduces their ability to use what remaining vision they've got. Contrast sensitivity. So this is being able to see an object against its background, where the object and the background are a really similar colour. So this means that a person might not be able to see furniture, curbs or even walls because they don't stand out against what's behind them, the floor and the room. So they're more likely to miss spills on the ground or other hazards on the ground that are more likely to cause slips and trips. Reduced night vision can cause a person to be unable to adapt to darker lighting conditions. So this means they're more likely to experience a fall at night because their eyes aren't able to adapt to that change in lighting level. And this can affect people in shadowy areas as well, or any areas that have low lighting. Another risk factor directly related to the person's vision is increased light-dark adaptation time. So this is the time it takes for a person's eyes to adjust when they move between a light and a dark space, or vice versa. I'm sure you've probably all had that experience where you have been outside in the sun on a hot day, maybe you're in the pool and you come inside and it sort of takes your eyes a while to adjust. You almost can't see until your eyes adjust to the change in lighting. So some people with low vision, they need significantly longer to adjust, and they're really sensitive to smaller degrees of change in lighting. So this means they probably need extra time to adjust every time they step out of the house, when they open windows, when they go inside, at a shopping centre or a clinic, and even when they go between rooms that have different lighting levels. Some other person factors include orientation and mobility skills. So this is a really special set of skills that people with low vision need. It involves learning ways to kind of familiarise yourself with environments, to travel from A to B, to mobilise safely in your home as well as out in the community. People with low vision can work with an orientation and mobility instructor to develop these skills, and it might include learning to use a long cane or even a seeing eye dog for some people. Knowledge of the environment is another risk factor. So we find that the clients that we work with are more likely to experience a fall in an unfamiliar area rather than in their home. So, and every client is different, but some people with low vision will be very familiar with the layout of their home, and they'll be able to mobilise really safely and independently using their memory and a few supportive low vision skills. But many people with low vision need support to learn new areas. When they're going to a new place, they'll need some support to learn the layout, to learn the pathways where things are, so that they can then become familiar, memorise the layout, and then avoid potential hazards. Knowledge and skills in using assistive technology. So people with low vision that have had training and are able to effectively use their low vision equipment, such as their long cane, are also less likely to experience falls. And the last one, leaning forward, down or over to get a closer look. So people with low vision generally need to move closer to something in order to see it more clearly. And that's about that near visual acuity or their distance visual acuity not being great. So I've seen lots of clients experience falls or near misses when they were leaning forward to have a closer look at something, leaning down to have a close look at where something is that they've dropped, or leaning over to get a closer look at something either at home or in the community, and that has put them off balance and then caused a fall. All right, so some risk factors in the environment are similar to the general population: uneven surfaces, footpaths, steps, thresholds, doorways, flooring joints, loose tiles, bricks, grass, all of these things. As uneven floor surfaces are a risk factor for everyone, but even more so for a person with low vision, because they're generally not able to detect visually and anticipate that surface is a hazard. Hazards on the ground: rugs, electrical cords, shoes, fallen leaves, all the usual things. Any obstacles or obstructions that blend in with the background. So things like a sign outside of a shop, a piece of furniture, perhaps some stairs or a curb that don't stand out from the background. If it's a dark colour on a dark background, that becomes a hazard for people with low vision, because they're not able to detect that hazard is there. Any sudden changes in level, without that contrast or without some warning, also creates a falls risk. Poorly defined walkways, so walkways where you need to navigate around furniture and obstacles, pillars, things like that. And also lighting, so low or uneven lighting also increases the risk of fall for people with low vision. And then finally, some risk factors in the activity section, in the activity sphere. So not using your low vision strategies is a key thing that we see with people who lose their vision later on in life. So they continue to try and do the things the same way they did when they had vision, and that can then cause a range of risks, and particularly increase the risk of falls. Not using the specialised equipment or using it incorrectly, completing tasks too quickly and not slowing down and being thorough, not being thorough enough. And so one example of that is sweeping the floor. You have a spill, get out the broom and sweep everything up, have a look at the floor. Yep, we've got everything. Our clients who have low vision might spill something on the floor, give it a quick sweep, not able to check that they've got everything visually, and so more likely to miss things on the floor and then experience a trip or a fall later on, because they weren't able to clean that up properly. So let's get on to falls prevention strategies. My aim here is to give you some strategies that you can use in your practice to support your patients or your clients, whether you work in inpatient or outpatient, that you can hopefully, there might be some changes you can make to the environment or the way you work with clients, and also some advice that you can give to the people you work with about how to prevent falls. So again, we're going to be looking at this model by injury matters, because I guess we understand falls as an interaction between the person, the environment and the activity. And so we can provide intervention in all three areas to then reduce the risk of falls for our clients. Some of the strategies to consider at the person level include encouraging your clients to undergo treatment and monitoring of their eye condition. And so this might mean wearing their glasses or their contacts, updating their prescription. They might need to change their medication or use it more consistently. And maybe they need to have a surgical intervention or another type of intervention for their eye condition. If the person is not under the care of an ophthalmologist, or they don't have a regular, at least 12-monthly appointment with their ophthalmology, it's really important that a referral is made, because ongoing monitoring is really important in making sure that if the vision is declining, that additional strategies and things can be put in place so that person isn't at increased risk of a fall. Encouraging the person to slow down and scan their environment while moving around can really make a difference. So just allowing plenty of time, don't rush them, so that they have that time to scan around the environment using whatever available vision that they've got. Also allowing extra time to adapt to lighting changes. And I've brought this up a few times. Perhaps the person will need to enter the room and then just stop for a minute or sit down immediately while their eyes adjust, because this is a key time when people experience falls, when they're in that transition time and their eyes haven't adjusted, they're not able to use the available vision that they've got. Some more strategies in the person field. Encourage the person to wear wraparound sunglasses and a hat if they're sensitive to glare and lighting. If it makes things feel more comfortable and reduces pain in a bright area, then it's absolutely worth doing. So this might mean that they need to wear glasses inside as well as outside. And I know some clients I have, there's particular environments where they really prefer to wear their glasses, such as the shopping centre or the doctor's surgery, because it's the fluorescent lights that makes them really uncomfortable. And each person and each vision condition will be different. But to offer that as an idea and to encourage the person to do that can increase the use of their available vision and then decrease their risk of falls. Also utilise sighted support. So some people, some people, especially if they've recently lost their vision, or if they've recently lost their vision, or their vision is just starting to impact their mobility, they're probably going to be preferring for a person to give them assistance while they're moving around. And actually, some of our clients who've had low vision for years actually just prefer to have a sighted person support them than to mobilise independently. On our website, we have video instructions for how to provide sighted guide support. There's quite a specific way of doing it that really gives the person the amount of support they need without kind of grabbing onto them or doing anything unexpected. And if I had time, I would have loved to have gone through that with you today, but as we're all in different places and we've got limited time, that'll have to be for next time. But log onto our website if that's something you're interested in, and have a look at our video instructions. And then finally, learn orientation and mobility skills. So in order to reduce their risk of fall, the person really needs to learn these specialised skills. They're not something that everybody knows. Things like trailing, things like using protective strategies, using a long cane, navigating in different environments. There's lots of really specialised skills that people need to know. And so that's when a referral to specialised blindness and low vision services is really important. All right, so next we're going to talk about the falls prevention strategies in the environment part of that model. So this includes things like walkways, using contrast, lighting, glare, and signage. The first kind of group of strategies that I want to talk about in the environment is related to walkways. So firstly, remove hazards from floor areas. This helps everyone. But in the office, it might be electrical wires, bags, maybe the tray tables, bins, things like that. And in the home, it might be shoes, clothes, toys, any sort of thing like that. And secondly, keep a nice clear walkway around furniture, and where possible, situate furniture at the edges of the room. So on this slide, we can see like a modern medical centre waiting room. It's got a range of different chairs and different colours, and they're all arranged around the room. So a room like this would be really difficult for a person with low vision to navigate. There's no clear walkway toward the back of the room where the door is, which I assume is the toilet, and the furniture is scattered throughout the room. For comparison, this is another waiting room of a doctor's surgery. You can see a clear walkway to reception and to the door in the background. All the chairs are in rows and there's no clutter between the rows, and the chairs have been pushed toward the side of the room. Another environment-based strategy is to use colour contrast to help distinguish walls, floor and doors. So low contrast sensitivity is really common in people with low vision, meaning that it's hard to see an object against its background. So to prevent falls, clearly define the walls by painting them a contrasting colour to the floor, and then mark the doors or door frames with another colour. So the Image on the left here on the slide is a modern dentist surgery, all white, all glass, very glossy. But even with typical vision, it's kind of hard to work out what the layout is and where the doors are. So people with low vision would have real difficulty navigating this dentist practice safely. On the right-hand side, we can see a hospital space that's been well designed with people with low vision in mind. It's got dark coloured walls which contrast well against the white flooring, and then the wooden doors have been left wooden to make sure they contrast from the doors so the person can find them. And you can use this same principle with furniture in the environment as well. So this prevents falls caused by not detecting the furniture as they're walking along in their pathway, or by misjudging the furniture while transferring. In the image on the left, you can see white chairs against a white wall, and then on the right, blue chairs against a white wall, much easier to see. So your patients or clients that you work with can use this same contrast strategies in their home to reduce falls. Walls, doors, furniture that contrast with the surrounding is more detectable. So in these images, again, you can see the difference between all white everything, hard to see for a person with low vision, hard to see where the furniture is in the space. And then on the right-hand side, you can see a dark-coloured bedspread, dark-coloured bedside table really stands out against the wooden floor. So more on contrast, things like pillars, poles, bollards, any sort of structure that might obscure a walkway really needs to be coloured to stand out against its background. It needs to be high contrast. So to show you an example again, we've got on the left-hand side two silver bollards against a grey background. This is really low contrast. And so on the right-hand side, we've got some nice bright yellow poles. They're nice high contrast against the grey background. They stand out. So where there is a dark background, a light colour should be used, and where there's a light background, if it's all white, then a dark colour should be used. If it's not possible to change the colour of a pillar or a bollard or a structure, then a strip can be used, whether you paint a strip or use some tape to make it more visible. And so the kind of recommendation or the standard is that the strip is 75 millimetres wide and between 900 and 1000 millimetres from the ground. So then you can add additional bands as well below at 200 millimetre intervals, and that's mostly if there's going to be kids around the area because their eye level's lower than an adult's. More contrast in the environment, the more contrast, the better. So clearly marked stairs and any changes in floor surfaces. So you've probably seen stairs painted like the ones on the right-hand side here with yellow on each strip. So this can be painted on, or there's non-slip stair nosing that can be fixed to each step. And this should be done on stairs, indoors and outdoors. It helps people with low vision to firstly realise the stairs are actually there, and then secondly, a better chance of seeing each step as they go down or they go up. The Building Code of Australia has detailed information about the placement and the style and the colour of these markers in public areas. I also wanted to add quickly while I'm talking about stairs, at the bottom here, I've got some examples of tactile ground surface indicators. These are those little bumps that you might find at the top and bottom of stairs or maybe at the train station. These are used to warn people who are blind or low vision that they're about to approach a hazard. And that can be stairs, a ramp, a traffic intersection, or possibly an overhead obstruction. So these are designed to be read tactually underfoot, by feel, or through the tip of a long cane. Or visually. So they're also high contrast so that a person with low vision would also be able to detect it visually. And so again, the Building Code of Australia has specifications about where these need to be in public places and also their required features. But in people's homes, obviously they don't have to follow the Building Code of Australia. And so we often do minor home modifications where we add high contrast strips like these in the picture of the stairs in a person's home to improve their safety on the stairs. and also teach them to use those tactile indicators when they're out in the community. Also, on the last one about contrast, contrast is so important. Clearly mark glass doors at eye level and make sure that the door handles also contrast with the colour of the door. So to meet the Australian standards, the line needs to be 75 millimetres. It has to extend the full width of the doorway and any side windows at between 900 and 1,000 millimetres from the floor again. All right, so moving on from contrast, in the environment, another important strategy is lighting. So people with low vision actually can require up to 3 times more light to do the same task as a person with typical vision. So in this slide, you can see an image of a kitchen with some just standard pendant lights. It creates a pretty dark and shadowy room, even though there's decent light from the window. In the next image, we can see the room has been fitted out with custom lighting, and this is done specifically to support independence and safe mobility for a person with low vision. So we look again, standard lighting that you'd see in any kitchen, just some pendant lights, and here we have customised lighting. So some of the simple strategies that you can do or recommend around lighting is just changing out the bulbs that a person's using for a brighter globe. Now, some people think that higher watts is brighter. That was previously the case, but now we've got LED lights and all sorts of things. The brightness of the light hasn't got anything to do with the amount of power, the watts. So what you want to look for is lumens, Lumens. Higher lumens is a brighter bulb. And so a bright bulb might be somewhere around between 800 and 1,000 lumens. But lots of light bulbs that you might buy from the supermarket might be 200 to 300 lumens. And so simply just changing out the light bulbs the person has in their home can make quite a big difference. Also add lighting using lamps around the house. The person might benefit from using a torch or a head torch. Increasing natural light where possible, opening the windows. And if something more complicated is needed, if you think that the existing lighting fixtures are just not going to work, then refer to Specialised low vision services. We do lighting assessments, recommend liaise with electricians to come up with a full plan for lighting in the person's home to improve their independence and their mobility as well. Something to consider when you are thinking about lighting, whether it's in your workplace or at the client's home, is the actual positioning of the lighting. So lots of rooms will just have one central light in a hallway or in a room, and it actually results in really uneven lighting in different areas of the room. So strongest directly under the light and then less lighting as you move further away. It also causes shadows in the person's path. So as you walk along, there's a shadow directly in front of you because of the positioning of the light. And so this makes it even harder to detect hazards in their path, like furniture, pillars, oncoming people. And so the positioning of the light is just as important as the brightness of the light. Another environmental strategy to prevent falls in people with low vision is to control glare. So glare can be a real issue for people with low vision. The presence of glare prevents people with lots of different conditions from using the vision that they've got available. So simply using blinds or curtains to reduce the amount of natural light can really reduce glare. Consider matte surfaces rather than glossy surfaces for counters or tables or whatever it is. And recognise that your client might need to wear sunglasses or a hat indoors if it makes them feel more comfortable. Some clients benefit from tinting, and that might be something to consider for their home. And most of all, consider the environment that you're working with the client. So it might be that you don't have any control over the window coverings or the tinting on the windows, but that if you're working with a client in a particular room that's really glary, you might be able to move to a room that suits their glare tolerance a little bit better. So another environmental hazard and strategy to be aware of is around signage. So people who are blind or have low vision might miss important safety information that's on a sign, just simply because they didn't see it. Some strategies around that is to increase the size of text on any signage, use bold text and a sans serif font. So sans serif is like Arial, there's no curly bits on the letters. Arial's probably the gold standard for that. Make sure the text stands out from the background and is high contrast. On the slide here, I've got some examples of low contrast versus high contrast. Really, white on black or black on white is best. And any signage should really be 1,200 millimetres to 1,600 millimetres above the floor level, because this is around eye level for most people. Another thing to consider is the lighting conditions where a sign's placed. So a sign, particularly one that alerts people to a hazard or gives people instructions about safety in an environment, the lighting's really important to make that signage and that information accessible to a person that's got low vision. So consider where it's placed and consider whether glare impacts the visibility of the sign. If it's a sign that is laminated, laminate with a matte laminating what's it called, pouch rather than a gloss one, because laminating a sign can increase the glare on it and make it unreadable. So I guess the main thing is that the signage, especially if it's related to any safety information, is as accessible as possible. Because if people with low vision are not able to access that information, they're more likely to experience a fall. This is an example, which I thought was a little bit funny, about some poor signage placement. So this is a high contrast sign. They've used good, sorry, the image is not perfectly clear, but they've used good colour contrast. It's even got Braille on it for accessibility, but they mounted it up so high that you can barely reach the Braille to read. It's ironic. So it's mounted too high. It's higher than our typical eye level where we'll be looking. And also, it's harder when we're looking and impossible to read the Braille because of how high it is. So just an example of a well-meaning but not a very accessible sign. All right, now finally we're going to cover strategies in the activity area. So a really important strategy that we teach our clients is to slow down. We all make more mistakes when we're in a rush, but this is even more the case for people who have low vision. So slowing down means that the person has less chance of losing their balance, more time to see and adapt to oncoming obstacles. They're more likely to be focusing on the task, which means less mistakes caused by lack of concentration. I recently worked with a client who was in her 40s who had a degenerative eye condition and she lived alone. And so she told me that she'd smashed several of her mugs by misjudging her coffee table. So she'd take a sip, and then when she went to put the coffee cup down on the table, she'd bang it into the coffee table and break it. And so she was really frustrated by this, but not just that, she then had the challenge of cleaning up the spill, her coffee or her tea, and cleaning up the broken china. So because of her low vision, it was really hard to do this properly. And so a couple of times she had missed some and either stepped in a puddle or stepped on a piece of china that she failed to clean up properly. So slowing down and being really thorough, it seems obvious, but it's so important to place her mug on the coffee table in a really careful way. And so we use both hands, feel the table with one hand, and then place the cup down, checking that the whole base of the mug was touching the table before she let go. It took longer, but it was worth it. And so then we also had to talk about being thorough with cleaning. And so lots of people with low vision initially try to do things the same way they did when they had vision. And in order to do the checks that you would do visually, you've got to be more thorough and slow and careful. And so we kind of used the mental images that she already had of the area in her home, to mop up the area that she thought that the spill was in. Obviously, she hadn't realised that pieces bounced into other areas and splashed outside of that area. And so the things that worked for this client in cleaning up were putting shoes on before she started, moving the couch and the coffee table out of the way to do a really thorough clean, sweeping the floor or mopping the floor in a grid pattern. So once in one direction from left to right, and then going back again, top to bottom or front to back, to make sure she covered every area and every area twice if possible. And so that grid pattern works really well for everything: wiping down surfaces, mopping, sweeping, cleaning mirrors, windows. Takes longer, but being systematic and thorough really can improve a person's safety and their ability to be independent in their cleaning and then in preventing falls in their home. Another activity strategy is to use magnification and increase size. So just like with the signage strategy, increasing the size of things in the home where there is text, whether that's in the home or in the hospital setting, it reduces the need to reach, bend forward, bend closer to read, which then increases the risk of losing balance. So this could mean the person uses something as simple as a magnifying glass or a more complex piece of assistive technology for reading, or it could be just increasing the font size of things around the place, like the clock or labels on things, so that they don't have to lean forward and lean close to read. Again, high contrast, bold print is easiest to see. Another activity strategy is to use mobility aids. So for people with low vision, mobility aids include the usual suspects, four-wheeled walkers and support canes for those who have decreased balance. But then there are extra ones like a long cane or a seeing eye dog. For these, mobility aids require lots of training to be able to use and specialist prescription. So strategies that you can act on is to remind the person to use their mobility aid and to refer them for specialist assessment and training if they haven't already. If they don't have a mobility aid, or if it looks like their skills are a little bit rusty. Most of our clients do a bit of an update every 12 months at least, just to update their skills and to learn anything they haven't learned yet. When clients first start with long cane training, for example, they usually do about an intensive 2 weeks before they feel confident to mobilise independently with the long cane. And the final activity level strategy is to prevent spills in the home or in other environments. So this can absolutely reduce a person's risk of falling. The spills are a falls hazard for everyone, but it's even more so for people who are blind or have low vision, because they're less likely to detect the spill on the ground. So this can include things like pouring aids. This yellow device in the top corner is a liquid level indicator. It just hooks onto the side of a mug, and then as you fill it up, it beeps when the water level touches the little prongs inside the mug. And so that prevents overfilling and prevents spills. Also a specialised kettle or jug, cups and containers with lids, and then in wet areas, well draining floors, drying the floor while cleaning, and also using non-slip mats. So this is a summary of all the strategies that we discussed by approaching falls prevention from these 3 directions: the person, the environment, and the activity level. If you're a person who likes to take screenshots of things, take a screenshot of this or a photo. This is kind of a summary of all the strategies that I've discussed that you might like to refer to later. I will make a little PDF of the slides and give them to Sue, and she can distribute them to you guys later as well. So as discussed throughout this presentation, there are lots of really specific skills and lots of really specific assistive technology that people who are blind and low vision need to learn to use. So it's really important to refer a person to specialised low vision services as soon as possible. It can also help with the adjustment to vision loss, the emotional adjustment. There's often a period of grief And when a person finds out that they're losing their vision, loses it suddenly, or finds out that they've got a child who has low vision. And so linking them in with supports is really important for not only their independence, but their well-being going forward. So some things to look out for, which might indicate that you need to refer to Vision Australia or Specialist Low Vision Services, is when glasses no longer correct a person's vision, if they're having any difficulties with their daily tasks, falls, trips, bruises and bumps from mobilising in home and community, if someone reports that it's harder to read or watch TV, or they're holding things close to their face, when someone needs emotional support or advice adjusting to their vision loss, if the person is diagnosed with a permanent and non-correctable eye condition or one that's likely to be progressive, or when a specialist says nothing more can be done to the vision. So some specialised services have, particular cutoffs around diagnosis or visual acuity. We don't. We're happy to support any client that's having functional difficulties. If there's no funding available, we're happy to support them with that. And we have a small safety net that we can access for clients that don't have funding available to them. So to refer, next page, anyone can refer. It doesn't have to be from a health professional, but it certainly can be. A person can refer themselves, a family member can refer, and it's on our website, www.visionaustralia.org, little online form, and it's easy as that. This is our office in West Leederville. We're at 148 Railway Parade. We're open normal business hours, and we have a vision store inside that's open to anybody. You can drop in and view products if that interests you anytime, but clients will need to make an appointment if they need some special support or if they need an assessment. So thank you. I've talked non-stop. Are there any questions? I'll have a look in the chat and see if we've got. Yeah, okay, so Julie Elliott has said, I've been advised that CHISP clients are unable to access lighting changes under home modifications funding. I believe lighting changes are fundamental in the home environment for falls prevention and to maximise optimal function. Can you comment on your experiences on how to access funding support for lighting in the home? Yeah, so we have had lighting approved under CHISP. Vision Australia isn't we only have one area, I think it's south, I'm not sure exactly where. We only have one group of suburbs that we service under the CHISP funding model. The main low vision provider in Perth is Visibility, which is another comparable vision specific service. And so within our area, we have had multiple approved, but I would recommend to refer that person to us or to another low vision provider, because we have had lighting approved under the CHISP model. You've said, can you comment on your experiences of accessing funding? Yep, so we've had it under the CHISP. We do have lighting funded under My Aged Care and NDIS as well. Sometimes there are low-cost solutions that people can use, such as changing the light bulbs, or there might be some task lighting, such as lamps. But I completely agree, it can be a huge factor in preventing falls and optimising function, like you said. So where it's indicated, absolutely, we can do an assessment and get that funding in place. Claire Ryan has said, is it possible to supply a copy of the presentation for staff who miss a session? Yes, it is. I'm going to make a copy of the slides and send it to Sue, and she'll distribute it for you. It's also being recorded and will be on, I believe, your YouTube channel to watch later. Are there any other questions? You're welcome to come off mute and ask.
I'm just very quickly going to stop the recording.
Sure.
Thank you. Sorry.